I just want to address wrinkles or hyperpigmentation or something like that. What are my non-invasive options?
Yeah, so I would start with, you know, what bothers you. So if it's skin texture, is it wrinkles, is it overall rejuvenating effects? So I think that, or just, you know, skin maintenance. So the first conversation is like, you know, what bothers you? If it's enlarged pores, if it's just overall skin texture, radiance, those are all kind of different options that we have to address, you know, skin quality. And so one option that we have is Botox for dynamic wrinkles. And a dynamic wrinkle is a wrinkle that happens on animation or when you're moving. So as an example, the forehead is the most common area, and the upper third of the face for Botox utilization. And so, you know, Botox is meant to kind of paralyze or soften the appearance of fine lines and wrinkles.
Okay, but that scares me. You're saying paralyze. And when I think about Botox as like paralyzing, I would think that that would scare someone. So what do we do to mitigate that? Like, is it possible to even get like Botox botched or like no?
Yeah, that's a real thing. So, you know, Botox is a toxin. So it's a derivative of something that basically causes, muscle paralysis. And in a targeted dose specific area, it basically results in softening of the upper third. So crow's feet, the glabellar lines, the 11s, and also the forehead. And there are other areas that can be used off-label as well. Some people are doing them in the neck or in other areas of the face, or, you know, also there are medical indications for it. Sometimes it's migraine or, you know, dystonias or muscle spasms, things like that.
Sweating.
So sweating, hyperhidrosis under the armpits, the hands, the feet. So there are medical uses for Botox, and there's also aesthetic or cosmetic reasons for Botox.
But people shouldn't be scared of Botox.
No, so
it does wear off.
It wears off. It's a temporary effect. You know, it can last 3 to 4 months in more hyper animated areas, sometimes a little shorter, sometimes a little longer. Everyone has like kind of a different effect, but to address your point, yes, there are possibilities that you can have complications, as with any procedure or surgery, with even the minimally invasive or non-invasive options.
But I mean, I think the takeaway though is go to a plastic surgeon. Go to someone who knows what they're doing, who understands the nerves of the face, the blood vessels, everything, right? Because when we're dealing with Botox in the hands of someone like you, you're less likely to hit something that'll cause another wonky effect in the face, because you really understand everything that's going on in the face. And also, you know, there is such a thing as like Babytox, I've heard people say. So it's like a little bit of Botox in very specific regions so that the face remains animated but not frozen, right?
Yeah, I think that's a fantastic option, actually. I mean, it's kind of my preference, but, you know, everyone has different goals. Some people are like, I don't want to move. I want to be paralyzed. Like, I don't want my eyelids to move. I don't want crow's feet. Like, I kind of feel that crow's feet are a little bit endearing. Like, it shows that you're soft, and, you know, I haven't had Botox in these areas.
And you look fat.
Well, that's subjective, but yeah, so like, you know, if you want some animation in the periorbital area around the eyes, just it gives off a warm kind of glow, but you do want to soften it, you can do Babytox. So it's just micro doses where you're not completely like no wrinkles, no completely frozen appearance. It just softens it.
Yeah.
And so that can actually result in the appearance of less fine lines and wrinkles over time.
I think like an important takeaway is that Botox, as with most injectables, it's not like a one-size-fits-all situation.
Right.
It can be curated. It can be, you know, very specific to each individual's needs, and then in turn can have a variable effect. You don't have to like have the same toxed face as somebody else. And I think that's important. So right now we have a fall promo. It's $18 a unit. You get a 2-week touch-up. And usually I think it's something like $22 a unit. So right now it's really great. And I think when we're thinking about how we go into the new year, if you want to feel refreshed, you can have a super refreshed look and you can feel brand new without having to be too invasive.
Definitely.
You know, and I think that that's great, especially going into the new year.
Yeah, I mean, I think you bring up an excellent point that it's really a curated experience and procedure because it's not a one-size-fits-all. Everyone's anatomy is very different. And I personally don't like the courses or the templates where they're like, boom, 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 here's where you do it, and that's the same for everybody, because that's just not true. It needs to be, you have to like actually assess the anatomy, have the patient animate, close their eyes gently, close their eyes tight, furrow in the glabella or the middle of the eyebrow region, raise their eyebrows, because then you can really calculate like what dose, what effect they want. And then, you know, also to bring up your point of there is such a thing as a kind of botched Botox procedure, because sometimes the toxin can migrate to the upper eyelid and then cause like a droopy eyelid, and that effect will, you know, persist until the product wears off. And so it's important to really understand the anatomy and like the dosage, the diffusion ratios, the distribution of the product over an area.
Go to the right person.
Yes.
You know what I mean? Like, I think when I think about Botox and I think about really affordable and cheap options, right? We see them all the time. And I'm not gonna like say any names, but you have to be mindful, right? And you want to make sure that you're seeing someone who understands all of these things to avoid it.
Right.
And if you want to experience Botox for the first time and you don't want to break the bank, come see us. Fall promo, $18 a unit. Dr. Vyas is going to be so happy to see you in the exam room, and he'll walk you through what is a good plan for you. And he'll make sure that whether it's, you know, a completely frozen vibe or you want something softer that feels more lived in, that we can curate that for you here. So just give us a call or check us out on Instagram, TikTok, or our website.
Like, follow, subscribe.
Period.